I have with me Dawn Forshaw. Everybody who knows about SMP knows about Dawn. So welcome, Dawn.
Thank you for inviting me to have a few words.
Thank you. First of all, Dawn, would you like to tell about yourself, how you came into this field of, scalp micropigmentation? How did you develop this field?
Yeah, I've been in the industry for a very long time in hair loss. I branched first of all, into eyebrow micropigmentation because I used to own a hair loss company providing wigs and hairpieces, and I saw a lot of patients that didn't have any eyebrows. And then from there, I moved into the scalp micropigmentation because hair loss brows led to hair loss on the head, and scalp micropigmentation, whether somebody had lost their hair or they wanted to work in sympathy and hold their hair. Densification micropigmentation worked really, really well with scalp transplantation. So that's how the marriage was born in our industry.
For those who do not know, myself and Dr. Preeti, we have gone to Dawn's Centre in UK at Hayward's Heath, which is slightly down south London. And we have been there twice, once in 2017 and then again in 2019 to learn different tricks and tips and a detailed how you can do scalp micropigmentation, how you can address scars and a lot of other things we have learned over there. That's how we came to know her, and she is constantly guiding us about how to do best in this field. So Dawn, where do you look at the future of the scalp micropigmentation, like next year or probably 2026, 2027? Where do you see this field to be moving towards?
I think scalp micropigmentation is a very holistic treatment. It's moving more that way to offer a total service to somebody with hair loss. So we know we can do densification in conjunction with transplantation, but I think also we're moving towards more about treating scars, treating the skin before scalp micropigmentation to make it more correct and more susceptible for the correct implantation evenly and smoothly. So I think more of that will come into the market, and I think a total service where we work out how much surgery is required, SMP is required, to make a total package so people know what they're going to buy, what they're going to receive. And micropigmentation mixed with scalp infusions will be, I think, the next stage for people that want to hold on to their hair, so they have surgery, but if there's not enough donor hair, the combination and now the maintenance by using the infusions, they come together to make people have a fantastic hair loss look.
Yeah, so it's a comprehensive 360-degree solution of which SMP you think is going to play a big part.
Yes.
As it is right now also, but moving towards, the future, especially treating FUT scars or even the FUE donor scars. Is this also something you think that this is also going to gain traction, because a lot of people are getting transplant done from clinic where the planning is not very, correct. They are over harvesting the donor side. So do you think that also has some role in the future?
Oh, completely, because people who have scars do not wish to have scars, and good surgery, there are minimum scars, but if they have a scar, it will be a bothersome thing to somebody, and we can minimize that scar and treat it. So I think that will make a vast difference to the industry and what we can do. And so there is nothing that cannot be treated in a hair loss restoration centre. No matter what the issue or the concern that brings somebody to the practice, there will be an answer that can be done through surgery or a needling service that will work together. So I think more treatments, and more treatments for women, because a lot of women, if they're going to have surgery, they're going to move their hair from one place to another, whereas with density by micropigmentation, it's a better solution.
So now coming to another important topic, we don't see many training courses of scalp micropigmentation anywhere. I think yours is one of the unique center in UK which is doing so, and sort of giving all the information freely to all the trainee people, whether they are doctors or other SMP artists out there. So do you think there is a need to have better learning and better accessibility to the young doctors who want to incorporate SMP in their practice?
Education is the key to successful, good quality micropigmentation. Whether that's theoretical learning or hands-on life skills, practical, is actually vital to have good application of technique to have the best results, because many times where there's good surgery, bad surgery that you have to deal with in repair, it's the same with micropigmentation.
Exactly.
You need to learn correctly to offer a fantastic good service, and then the patients love you, they recommend it. It's just a wonderful thing for them to work together. So I look forward to setting up training with you,
Yeah,
because
sure,
I think it's vital, and a good surgeon isn't necessarily a good practitioner, because it just needs learning skills, and that is not just learning the technique, it's learning how to understand what is the right needle to carry out the treatment, what is the right mix of colour, whether that's a long-lasting ink diluted to a scalp shade, or whether it's a woman who needs a colour combination pigment to have a better overall result. So understanding colour, understanding needles, and the technique, the angle, they all come together in good training, and we've worked together for a number of years.
Yes.
And you offer fantastic treatment, so it's right
Yeah,
now that you offer the right
we
training.
have training courses for the hair transplant, but SMP is something we are looking forward to. And you're absolutely right. Nowadays, we are seeing a lot of patients who have got a SMP done by tattooing. Blue ink is being used. Very thick needles are used. So, I mean, doing it correctly is absolutely important. And we see a lot of patients in whom we have to remove those tattoo pigments using lasers, Q-switch lasers and all. And it's a big hassle. You have to come multiple times, and still there is some fading, some see-through, which always remain there. So training is absolutely essential. Also, coming to the last question here, pigments, the refinement in the pigments for SMP and the machines, do you think this is already happening in your field?
Oh, very much so. And with regard to pigment, you need to think before you ink to make sure you choose the right medium, whether it's long lasting or shorter lasting. It needs to be a REACH compliant colour that fits and requires all the regulations, because this colour is going into the skin, not on the skin. So you need to make sure it's not harmful, it's correct for you. So as long as the needles, that is important. But the new needles that are launching, that will be available from next year, are super fine. We've never before had needles that are so fine to make true impressions that just are almost undetectable, be that in scalp work or the eyebrow work. They are fantastic, game changer, next level needles is how I feel I class it, and it's taking the hair loss industry with surgery, micropigmentation to a completely new level.
Thank you, Dawn, for giving us such a precious time, and really looking
Thank you.
forward to
Thank you very much for
starting the
asking me.
courses in association with the FTZ.
My pleasure.
Thank you.
you.
Thank you.